My name's Sean Tackman. I'm a firefighter in San Jose. I've had 5 shoulder surgeries. What I love about this field and what I love about the job is that I'm able to make a difference. You know, it always sounds corny that I love helping people, but I truly do. The physical toll and the physical demands are hard. This is one of the busiest stations in the city. Our structural firefighting gear, where we're wearing our helmets, our turnout coats, our bottles, our boots, adds about 80 pounds onto your person. And then we have lots of high rises, so we carry that equipment up those flights of stairs every single day. And those stairs get old and tiring. I'm not one to typically ask for help. I'm the one going and helping people. My initial shoulder injury was when I fell through a roof at work. I was on a roof, we'd ventilated, and I was wearing all my gear, and I stepped through a hole and fell up to my shoulders, but I put my arms out. I broke 2 ribs and dislocated my left shoulder. After my initial injury, I had a few consultations with orthopedists, and then I was scheduled for my first surgery, and that was over 6.5 hours long of reconstruction. If you looked at my left shoulder from in a clock perspective, it was torn from 7 o'clock all the way around to 5 o'clock. So there was very little in the bottom that was still holding on. It was a glenoid labrum, and that's what that 6.5 hour surgery was, and it really wiped me out. What occurred between the first surgery and the last surgery, number 5, was different injuries. Part of the reason that I have had 5 shoulder surgeries is because I pushed so hard. I didn't realize that the body was creating limitations for me, and I wasn't able to take that. And I pushed through those, which ultimately blew out some of the anchors that were put into place. And that's the need for the other shoulder surgeries. Surgery number 5 was a total shoulder replacement, and I talked a lot with Dr. Castoros on the pros and cons of both, of not having it, waiting, or going for it. I decided to go for it because he said it's going to be a quality of life change. It was a personal decision at the time because the arthritis was so bad that I couldn't sleep, I couldn't lift my arm over my head. There was a lot of stuff I couldn't do. I had 2 small boys at the time, and I couldn't even throw the baseball for them, and that was the thing that really drove me to get it replaced. So shoulder surgery number 5 was my first open surgery, and I have a scar that goes from here to here. And so there was a lot of muscle and a lot of tissue that was cut open and had to heal, so it took a much longer time than I was ready for. But I took that mindset, taking my time and making sure things were set before I started to push it. And as I started to push it, I gained in more trust in my shoulder, in the fix, in the surgery, and in the implant, that I can now do my job because I took my time, built my foundation, and it's as strong as it's ever was. The advice that was given for preparation was get as strong as I could before, mentally and physically. In terms of PT and future rehabilitation, do exactly what the doctor says. Don't do more. I was of the mindset initially in my first 3 or 4 shoulder surgeries was push harder. If the doctor tells you do 10, I'd do 20 or 30. It took me those times to figure that out, that the body will only recover as fast as it's going to. It puts its own self on a timeline. No matter how fast you want it to go, your body will heal at its own timeline and its own pace. Sleeping is a big one. Get as comfortable as you can. I noticed that if I had put pillows behind me and behind my left shoulder, so kind of in an L shape like this, it was much more comfortable for me to be able to sleep. And then I felt better, more rested, and then I was able to do my PT and focus on that. Where I'm at now, after surgery number 5, the quality of life is much better from where I was before. It doesn't ache on a daily basis. I haven't dislocated it like I used to. I'm more cognizant of the metal that's in there. I'm very, very careful about it. My advice for anybody having their first or their 5th shoulder surgery is take your time. Don't rush it, don't push it. Ask for help. Set yourself up for success.